Hello, and welcome to iDrop, the podcast of the Association of Caribbean Glaucoma Surgeons, where we shine the spotlight on glaucoma in the Caribbean. I am Desiree Murray, ophthalmologist and senior lecturer at the University of the West Indies, St. Augustine campus in Trinidad and Tobago. Joining me today is Dr. Vandana Persad. Dr. Persad is a postgraduate Year 5 trainee in ophthalmology at the University of the West Indies, St. Augustine campus. And we are at the beautiful Hyatt Regency Hotel in Trinidad and Tobago and the 35th Annual Congress of the Ophthalmological Society of the West Indies. Welcome to iDrop, Dr. Persad.
Thank you for having me.
Dr. Persad, you were involved in the management of an interesting case of bilateral acute angle closure glaucoma in a patient with a condition known as relative anterior microphthalmos. This case was presented during the glaucoma session at the Ophthalmological Society meeting here in Trinidad. Could you tell us what is relative anterior microphthalmos?
So, relative anterior microphthalmos has to do with patients who has shorter eyes, length of the eyes with a smaller segment to the front part of the eye, and the rest of the eyes being normal length and thickness and size.
Okay, so it must be important then that the front part of the eye is the small part, and that is something that leads to this particular condition and the complications of having a relatively small eye.
Right, so the front part of the eye has to do with the drainage angle, and having a smaller compartment to the front of the eye significantly affects the drainage angle, since there is like a blockage, a physical mechanical blockage of the drainage angle, with that segment being significantly smaller.
Okay, so could you tell us about this specific case that was presented?
So this case that we presented was a 67-year-old female who presented to our emergency department with high pressures in the eyes and significant reduced vision. And on examination, we noted that she had a very small anterior segment, or the front aspect of her eye was very small,
Right.
compared to the rest of the eye.
Okay, I understand. And how was this case managed?
So this case was managed with first we performed gonioscopy, and this is a procedure where it's routinely done in clinic, where we look at the drainage angle of the eye or the compartment to the front. So that tells us whether it's mechanically blocked or whether it's
Open.
open.
Right,
Yeah.
I understand. Okay, and what was the outcome? Did this patient have a good outcome? How did we manage this patient?
So this patient was managed with with cataract surgery plus intraocular lens. But in this particular case, we also did something called iridozonular hyalodectomy, which has to do with creating a passageway between the anterior segment and the posterior segment of the eye. And this was done in a prophylactic way, for prophylactic reasons, just to ensure that this patient doesn't subsequently go into something that we call malignant glaucoma.
Okay, that sounds serious. So one of the risks of having relative anterior microphthalmos is that after cataract surgery, they can develop this malignant type of glaucoma.
Yes, but it is not common. But in these type of patients with particularly small eyes, malignant glaucoma can arise. But not everyone that has cataract surgery goes into malignant glaucoma. Only those patients who are predisposed with short eyes has a chance of this happening.
Okay, so apart from gonioscopy, how did we know that this was the condition that this patient had? Yeah, so were there other measurements that could have?
So, right. So apart from the gonioscopy, we did the axial length measurements, and this is where we realized that the axial length is a measurement from the front, the cornea of the eye to the retina, and we looked at the size, and we were able to tell that this patient has a really short has a normal size eye, but a really small segment to the front, but a large lens.
I understand. So, Dr. Persad, what are your key take home messages from this case?
So from this case, I would say gonioscopy should be performed on every patient, and once there is a sign or indication that there's narrow angles, and these patients are what we call suspects, we should measure their axial length, so that way we can determine whether any precautions need to be done and what needs to be in consideration when performing cataract surgery for these patients, as well as knowing the parameters and what we have to face when doing cataract surgery.
Okay, so it helps us plan for surgery to have a good outcome.
Yeah.
Well, that's a very good note to end on. Dr. Persad, it's been an absolute pleasure speaking with you. This has been iDrop, the podcast of the Association of Caribbean Glaucoma Surgeons. Together, we can end glaucoma blindness.